Hi everyone, I've been asked to record this technique that John Smartt taught me at the endometriosis course, but it's also got a really great use for psoas. And the actual reason that somebody asked us to record it now, I cannot remember the specific reason, but I use it for psoas, I use it for hip restriction, I use it for bowel restriction, and I use it for all gynae kinds of pains as well, and to help support the lymphatic system. This is John Smart's IP. I'm just recording it for him. It's also the way I do it, so it might not be the way John does it. It's the way I've adapted it. I also give this as a take-home exercise for my patients, so they can actually take home this hip movement, and it's really helpful in getting the difference in function between the psoas muscle, the low back, and hip rotation. So it's just fun to play with it. And as with all of John's brilliant discoveries in osteopathy, he's always happy for you to take it home, adapt it, and then improve it for you, and then give him feedback, because he's one of the biggest learners around as well. So first of all, we just contact through the iliac crest, and I cup around the iliac crest. And I've got my thumbs here. If I bring my thumbs onto the inside of that iliac crest, I'm going to come into iliacus and psoas muscle. If I just slide a little bit more medially, I'm going to be contacting the ascending colon, or the fascia around the ascending colon. And so one of these things that happens with definitely in adhesive kind of situations in the bowel, or in the pelvis or abdomen, is that you can't really feel the difference between, excuse me, just a minute, patient. If you have any pain, just raise your hand and let me know, because we don't need to hurt you. So what you'll find is it's really difficult to feel the difference between whether you can feel the iliac crest, but then you come in and you're trying to feel iliacus or psoas, but they're all seemingly connected through the fascia to the ascending colon. So you come in and cup that, and you're trying to get inside the iliac crest area, and you'll feel that adhesion. So that's the contact for the technique. But first of all, you have to teach the patient how to use their leg for the movement of the technique. And so what I do, first of all, I guide them through it. So we slide. I've got a bolster here. I didn't turn on the highlights, but we're going to see it. I think we can do this. So we're going to slide the leg up, and it's good because the patient's wearing a very good light colored sock, so that's working. So we've got the knee here. I've got my hand on the ankle, and I'm just going to support as the patient brings up the knee to right angles. And then we're going to be rotating the hip out, so towards the camera, out, and then the patient, I'll let their leg go and they'll rotate down that way. So just rotating down, and I let them go. I ask the patient to bring their foot back up into my hand there, and then I guide them back through in exactly the reverse of what we did before. So we've now got the knee back at right angles, we put the foot down, and we glide it down. So here's a bolster. In some people I have a bolster, in some people I don't. I'm going to flick on the light so you can see it, the actual technique. Sorry, patient. The patient now has light shining in their eyes. I don't usually do this. This is the handhold again. And now I'm going to ask the patient, while I'm palpating that area, the iliac crest, I can glide through the fascia of that ascending colon there. And I can glide over that part of the bowel as well. So we've got the assessment of the tissue texture feel there. And I'm going to ask the patient, they don't usually get it right on the first go, so I'm going to try to guide them verbally through the movement. So if you could slide your foot up to bend up the knee, sliding the foot up to bend up the knee, picking up the foot, and you'll be keeping the knee bent, and you come right up to right angles, which is perfect. You can drop your foot just a little. That's it, that's perfect. And now you're going to rotate your hip out to the side, and then you're going to drop your foot down. Got beautiful hip movement by feeling there. I'm going to bring up the foot again. Yep, bring the knee in now and put your foot down on the table and just glide down. And so what I was doing through all of that was I was maintaining contact with the iliac crest, and I was figuring out whether it was the bowel, whether it was the iliacus, whether it was parts of the fascia that needed my support. Now, if it's a hip issue, the hip joint is just here. So sometimes I'll use it. I'm palpating the hip here, supporting the iliac crest. I'm going to get the patient to do that again. And in this instance, I'm going to be holding onto the hip. So slide up the foot, bring up the knee, drop it out to the side. I'm holding pressure in that hip joint. I'm watching the hip. That's it. And the patient can feel the difference in tension there as I'm supporting that hip. Bringing up the foot again, bringing up the knee, putting your foot back on the table and sliding down. And so to retest, getting really good hip movement there. Sorry, patient, I was a bit forceful. Just checking in here with this fascia. Now, I give that to patients as a take home as well, so patients can learn how to do that hip movement. If anyone has any questions or wants a different kind of recording, just let me know. Thank you.